Hello, everyone. My name is Thomas Reed. This is the Arizona Standardized Transition of Care Policy. This policy idea is something that I developed to improve communication and patient safety during hospital transfers. To be a little bit more specific, my policy focuses on what happens when a patient is leaving a hospital and it is being transferred to a secondary facility for continued care, somewhere such as a rehabilitation hospital or a nursing facility. The idea behind this is pretty simple. I want to make sure that when a patient is moving from one facility to the next, the receiving healthcare team has all the important information that they need to safely continue that patient's care. So let's get into it. Why transition of care matters. So before I get into my actual policy, I kind of want to explain why I think the transition of care is such an important issue. When a patient is leaving a hospital and moves to another healthcare facility, there's a point where a lot of information has to be moving in with them, such as what medications are they taking, what treatment have they already received, what tests and imaging results are still pending, what the plan is moving forward, what kind of appointments they have coming up, stuff like that. So the problem is that this communication isn't always as consistent as it should be. And so oftentimes this leads to a lot of information being missing, delayed, or ambiguous. It's not as always crystal clear as it probably should be. So when that happens, medication errors are likely to occur. There can be delayed treatment, duplicate testing, and worst of all, preventable readmissions, which of course is something that we absolutely do not want and would like to avoid at all costs. So this is why I think communication during these transfers is so important. Why I chose this policy. It's a mix of personal interest and course experience. I gained personal interest through the course experience, I guess you could say. So I chose this topic because improving communication and patient safety has become one of the areas that I've noticed interest me the most, I guess. And I think that's mainly because it's something that we can do that isn't just, directly about the medical treatment that a patient is receiving. Sometimes it's just, improving the systems that support doctors and nurses and other healthcare staff so they can do their jobs effectively. And then when that happens, the patients are benefited. So kind of where this came from is a couple of case studies I did. One class was the main one was Mr. Stanley Berger in a class I took in the spring. I can't remember which class it was. But those classes and those case studies made me think about what could actually be done to prevent these communication gaps. Both of those patients experienced such fragmented care that, had a policy like this been in place, a lot of the readmissions and complications that they suffered from could have been completely reavoided. So that's kind of where the idea and the interest for this policy came from. The current Arizona policy and need for change. So the next thing I looked at was, what does Arizona require? What's already going on here? Arizona does have requirements for hospitals when it comes to discharge planning. Hospitals aren't just sending patients willy-nilly out the door without any plan. They're sharing information with other facilities. The gap is that there's just no statewide standard, no requirement for how this has to be done. So it's done at different levels, at different hospitals, and different things are getting sent to different secondary facilities. And so, my policy isn't meant to replace what's already being done. It's more to strengthen it and standardize it, and kind of create a requirement that everyone needs to follow so that going forward, these secondary receiving facilities have a standardized amount of information that they're receiving to benefit the patient. Proposed Arizona standardized transition of care policy. So now that I've explained the problem and the gap, I kind of want to explain exactly what the policy would do. This proposal would require every licensed hospital in Arizona to use a standardized electronic transition of care, also known as a TOC packet, whenever a patient is transferred to a rehabilitation hospital, skilled nursing facility, long-term acute hospital, or another post-acute care facility, any secondary care facility. One part of this proposal that's really important to me is that the information would be sent before the patient arrives at the next facility. That's really the key aspect here. That information needs to beat the patient there. That gives the receiving healthcare team time to review this packet, look over what they need to do, look over what they need to have ready, so the patient can receive the best healthcare treatment possible. So while many hospitals already send this, there isn't one statewide requirement that's saying exactly what needs to be sent and included every time. That's another problem that the policy is trying to solve, along with the information beating the patient there. What would be included in this TOC packet? And that's the next question. My policy would require that every packet would include information that the next healthcare team needs to safely continue caring for the patient. So, what's the primary diagnosis? Diagnosis. Their current medications, allergies, discharge reconstructions, any pending lab or imaging results, follow-up appointments. It could be equipment needs, therapy needs, contact information, family contact information, primary care provider information, anything like that. None of those things are particularly new by themselves, obviously, but the difference is that the policy require every hospital to have all of that same core information in one packet getting sent to the secondary facility before that patient arrives. And this kind of consistency can really help reduce confusion. It can help providers make better decisions, clinical decisions, and hopefully it will improve patient safety. Historical development and implementation timeline. Excuse me. One challenge with this project is that my policy doesn't actually exist yet, so there isn't like a legislative history to talk about it. So instead, I looked at how this issue has developed over time. So over the last several years, patient safety organizations and healthcare researchers have placed a much greater focus on improving transitions of care because they found that communication failures during patient transfers can lead to preventable medical errors and unnecessary hospital readmissions. Arizona has taken some steps by requiring hospitals to complete discharge planning before the patients leave the hospitals. So again, this proposal is kind of adding on to that and standardizing that for transitions of care. If this policy were adopted, I think implementation would happen in phases. Hospitals would first update their EHR systems and train staff on new requirements and new technology that might be needed. And once the policy is in place, Arizona could monitor things like readmission rates and medication discrepancies to collect data and see if this is actually working or not. And I think it's important that any new policy isn't just implemented and forgotten. It should be continued to be evaluated over time and see if it's actually working. And if it's not, what can we do to be fixing it? Arizona policymaking process. This is all pretty standard across every state. I hope everyone has a good grasp on this. The bill is introduced in the Arizona State House or Senate. It's reviewed. There's public hearings. People have a chance to support or oppose it. Stakeholders, we'll get into that a little bit later. There's a House vote, Senate vote, and then the governor at the time would sign it or veto it. That's pretty much how that shakes out. And the policymakers here that we would need to be kind of swaying are the Arizona state legislators, the senators, the representatives, the governor of Arizona, and the Arizona Department of Health Services. Their support on this bill would be huge. And I feel like this has a good chance of becoming a bipartisan bill, which would be really cool. Stakeholders, supporters, and opponents. So every healthcare policy affects different groups of people. So it's important to think about who would support this proposal and who might be having concerns about it. So I think the biggest supporters are, of course, going to be patients and families because they're ultimately the ones who are benefiting the most from this. They're getting safer and more coordinated care transitions. But I also think post-acute care facilities like nurses, physicians, other healthcare providers would support the policy because it's going to make continuing care a lot easier for the patients that they're receiving and for the patients that they're transferring to these receiving facilities. However, on the other hand, I think small hospitals, especially in like rural communities, might be worried about cost. Anytime they're required to buy new technology or new software or something like this, it's going to be expensive. And I think some EHR vendors could even have concerns about it with software modifications and interoperability expenses. How does this work across multiple different systems, stuff like that. And I think hospital administrators in the short term wouldn't be a big fan of it. But I think long term it would benefit hospitals with hopefully lower readmission rates, cost wise at least. Consumer advocacy strategies. One thing we've talked about throughout this program is that patients should have a voice when healthcare policies are being developed. I think we've hit on that every class I've taken so far in this degree. Even though this proposal focuses on hospitals and healthcare providers, patients and their families are really the reason that this policy matters. They're who's at stake here. They're the ones who are experiencing these consequences when communication breaks down during a hospital transfer. I think one of the best ways consumers could support this policy would be by sharing their own experiences with legislators during committee hearings. Patients could also work with advocacy organizations, hospitals, community groups to be raising awareness about this. And I think combining personal experiences with evidence from healthcare research creates a much stronger case for why this legislation is ultimately needed. Future innovation and policy recommendations. I think that excuse me, I'm sorry. I think that this could be expanded across multiple states. I think that one day, dreaming big here, I think this could be a federal initiative that would be really cool. Um, and my recommendation would be to implement the policy statewide and then evaluate the outcomes before expanding it to additional healthcare settings or additionally expanding it, across other states. Um, my conclusion, key takeaways. When communication failures happen, there's a significant safety concern for our patients. Better communication is critical in all facets of life, and in healthcare, the fact that something like this doesn't already exist in our state is a little bit concerning. One final thought that I want to leave you guys with is standardizing communication is one of the simplest ways to improve patient safety without changing how medicine is practicing. This is something that we can do and implement without changing, a bunch of doctor training or a bunch of nursing training or adding classes in med school or something crazy like that. This is a simple, easy fix to a lot of different problems that we're having. Here are my references. Thank you all so much for listening and watching, and I had a great semester with everyone. Bye bye.